learning objectives for today. So we're going to start off on looking at what the definition of patient-public involvement and engagement is. We're using the definitions under the National Institute for Health Research, as well as NHS England guidance, because we follow both of those as an NHS trust, and the National Institute of Health and Social Care Research as our main funder of research in the UK. Then we're going to talk about why patient-public is important. So why should we do it? What's the benefit? What's the benefit to us? And we'll go through a few examples, tangible examples of people who have done it and shared why it's important. We're going to have a quick look at the standards of patient-public involvement. That is both from a national and local perspective. And of course, we do have local standard operating procedures, templates, guidance, and processes for you that I will share at the very end of today's session. Then we're going to look through designing patient and public involvement activities, right from where do I even start and at what time, how do I do this, all the way through to the practicalities, such as what costs could be associated with this and where should I hold it, for example. And importantly, of increasing importance is looking at equity, diversity and inclusion when we think about involvement. And I'll leave that one there because I'll go into that when we get to it. But essentially, you know, if we're looking at this, it should be at the top because that is what all our involvement should be based around. And then finally, at the end, some more resources around infrastructure and support available to you. Does anyone have any questions before we move on? No? Okay. So first of all, definitions. So patient-public involvement in research, and this is taken from the National Institute for Healthcare and Social Research. At its core, it's about doing research with or by our patients or our public, so public members, so your population to whom you are looking, your project is looking to improve the outcomes for, or what you're investigating. So it's not doing it to them, such as a research participant, or for them. So it's not just saying, you know, this is what I'm doing, and you know, there we go. What's your thoughts? Okay, I'm going to do it anyway. It's really about that reciprocal relationship, a constant and continuous reciprocal relationship in co-developing something. And there's some examples there. Involvement is very different to engagement. So engagement is around building awareness, being visible, having transparency about what we're doing. A very good example of engagement is going to an event, having a stall, speaking about your project, what you're doing, even your roles, your jobs. And that's raising visibility. I'll talk about why. You know, there's a lot of benefits to that as well as involvement. And finally, we talk about patients, carers, but also the public. So as we go through today's training session, it is really any of those or all of those. And that's who we refer to when we say PPI. It's patients, carers, public members. It's people. It's everyone. But it's what's relevant to your specific area. So it could be relating to the health services they use, people who could be affected by a particular condition, so people who may be at risk of developing a condition, or people who already are living with that condition. So they're the key definitions, and when I refer to PPI, that's what I'll be referring to throughout the session. Okay. So just as a recap on what involvement is. So what is it about? It's about actively involving members, publics, as we like to call them, doing research with people or by people. So, you know, the gold standard for us is actually empowering patients and the public to lead research, to come up with research concepts and questions themselves, and then actually deliver that themselves. That's the gold standard. It won't apply everywhere, but it's really about doing it with or by people and having an active partnership, reciprocal, as I mentioned. What is it not about? So research participation is one of the key areas. So if someone gives a blood sample or fills out a questionnaire as part of the data study, that is not involvement, that is participation. So involvement would be then co-designing that questionnaire. So there's a very big difference between involvement and participation. So it's absolutely not about someone taking part in a trial. And it's also different to engagement. So it's not, involvement is not standing on a stage and speaking to people about the results of your trial, that is, or your study or your project. That is engagement. Involvement, again, reciprocal relationship. Okay. So how does it add value? So it can help healthcare scientists or anyone who is working in non-patient facing research focus on areas and really define what is most important to that population. So an example here from a researcher, essentially, rather than, ourselves, I'm sure we could sit in this room and discuss what we think is best for a patient population, or what we think is most important, where funding should be invested, what really matters to a patient or to the public at large. But that's our opinions. We don't really know until we're speaking to the people to whom the project could benefit, who are being impacted by that area. And of course, this is going to change depending on the geography, on the location, on people's right circumstances. So that is one of the true benefits of involvement, is to really define and focus what you're looking at, so it is ultimately the most important thing, or what could have the most benefit. Secondly, it motivates researchers to know why their research is important. So I think for people here, I know I've come around the room in person, I've got pathology, microbiology, stem cell projects. It's about focusing on why their projects and why their research is important, and why you're doing it, ultimately. So that end goal, why am I doing it, the benefit to the patients. The quote here from a researcher who spends hours in a lab focusing on a small part of a disease, you can forget why you're doing it. So it's getting back to that bigger picture. Why am I doing this, and what's the ultimate goal, endpoint for me here? So it can also raise I think I've just referred to this, so it can raise awareness of the importance of this type of research. A lot of people, when they think about clinical research, and we know that is, first, especially with COVID-19, with vaccination trials, they can think about that, and that's the go-to when people are thinking about research that's being conducted. But the really raising importance about the importance of healthcare research in general, and also research, a particular area of research. And so there's another quote here from a researcher. It's important to understand what I spend my day doing. It's so much more than looking down a microscope and staring at cells all day. So the more, and this goes back to, again, additional benefits. So the more the public understands the importance of healthcare science in research, the more they can rally for more public funding in this area. So that's the larger goal as well. And it helped to provide accountability for the funds raised by the public. So I mentioned that the National Institute for Health and Social Care Research are are the largest funders of research in the UK. They're a government body that is public money. So if we look at it from an ethical and moral standpoint, they have a right and should be involved in how and what research is designed for them. So there is 100% the accountability, funds raised, that we should be involving them in that decision-making process and the design process of any innovations. And another quote here for you. And then final slide around how PPI adds value. It helps patients, carers, public build links with funders in the charity sector and advocate for a particular area of funding. And ultimately, the earlier you do it, will mean that you're building those relationships, you're really getting the patient voice behind the importance of your project, your particular area, and that will fundamentally help if you are ever thinking of applying for a grant application, if you're thinking of applying for ethics, because patient public involvement is a mandatory requirement now of both funding applications in the UK and ethics considerations under the Health Research Authority. So it used to look very favourable, now it is mandatory, which is very good, but that's why we're here to support and help you through that process. So has anyone got any questions around why? Can you have a look online? No. So, more of a boring slide here. Apologies, and I will circulate these slides so people have a good idea of extra resources and things to look at. But I just wanted to set the scene for, in the UK, we have a lot of guidance around standards of practice and best practice for involvement in and engagement in research. There are a lot of resources and guidance out there. They all say roughly the same thing. So it is really fundamentally about involving the right people at the right time. We also have local operating procedures and strategies, which I will circulate after this session for further reading. But what I'm going to go through now is a step-by-step process of how you would design involvement activity for non-patient facing research. So you could get a real gist of involvement, hopefully, in action from kind of start to finish. So, starting point. What do I want to achieve? So the first question you would ask yourself is, my project, what am I trying to achieve? What could I meaningfully, how could public or patient perspective meaningfully impact my project? How am I going to do this? Or what do I want to achieve? And you do really need to have a key idea of this before you start any involvement activities. So a few examples here. I want help deciding on what areas to focus on. I'm starting out. I actually have got a broad spectrum of areas I cover, and I don't know which what's important to the population, the public, or my patients. So actually, it'll be best to ask them, so they can really help you focus and narrow that down into what is most important to them. Is my potential research methodology acceptable to people? Is it ethical? Do they think that the samples that are in the Nottingham bioresource should be used for this purpose? Is that important to them? Do they think that it's ethical for me to be, analysing this in this way? I'd like to know how important and relevant my research is to people living with the condition I'm studying. So that's about, again, us thinking, oh, I think this is, what really matters to people. This is really affecting their, standard of life. But actually, that's not their main concern. And we find this happens a lot in research when speaking to the public. Our perceptions of what is most important is not their perception of what is most important. Are there any existing health disparities that need to be addressed? So if you're looking at again, I'll refer to the Nottingham bioresource. If we have samples of patients who have diabetes, is that sample, the cohort that I would like to analyse retrospectively, is that representative of the population in Nottingham who have diabetes? Do I need to go and collect more samples? Am I actually looking at a representative cohort, and is it diverse enough? And if not, how do I do that? How do I get more data, more samples? How do I ensure inclusivity and accessibility? And that's by, again, speaking to that patient population. I would like patients' carers to help me advocate for the importance of this area in lab-based research. These are just examples. So I'm not saying this is a definitive list. These are examples of what you could achieve, questions you could ask yourself. There's a lot more practical elements that they can help with. So if you are submitting a funding application or a report, they can help you with the plain English summary. sections. This is really important again in regards to engagement, visibility and transparency. We know if we get to specifically to a dissemination of results or anything that is, we want to be public facing, it's not suitable to be public facing, especially in regards to publication. So it's really about like, how can I make this truly accessible to the people who it should be in front of? How do I do that? And there are many creative ways that we can do that as well. Not just report writing, videos, infographics, thinking a bit more creatively about how we do that. And then again, I'd like to have an understanding of what it's like to live with the condition I'm studying, and I'd like to communicate the results. Or any questions? Any questions on?
One question.
Yes, of course.
When you're thinking of a research project, I mean, you don't think of it in a vacuum. You already are aware of a lot of the questions that you've postulated there. So you just think this is the respectfully pretending attention or an involvement.
Sorry, I don't think so. When you're developing a research project.
Well, when you thought of a research idea, because you're already working with that group.
Oh, with patients, yeah. You're a step ahead. Yeah.
And do you need to produce evidence of all that sort of documentation?
Yes, if you've already done so, I'm saying this is going from very, very, this is concept.
Right, okay.
So you could already be ahead of that. You could already be working with your patient population, and I guess it's important to continue to ask the questions, especially around, have I involved a representative cohort of that population? That's always important to ask. But yes, if you've already been working with patients to co-develop your research question, you're already ahead of it. So it's always best practice to document what you've done as well. So who you've involved, how you've involved them, what their feedback was, and how this has then come to, co-developing a research question. Absolutely. And we do have templates out with that as well. Has that answered your question? Sort of. Yeah, okay. Yeah, no problem. Thank you very much. Right, online. So, sorry. Liz, sorry, please come in.
Oh, hi, Kate. Yeah, thank you. This is really interesting. It's just a quick ask, actually. We can't hear online the questions that are being asked. So if you could sort of repeat the question back, that would be really helpful. Thank you.
Yeah, no problem at all. No problem. I will ensure to do that. So I think the question there was, if you've already worked with patients, the public and relevant populations, you technically have already asked all those questions on there. So yeah. Do you need to repeat it, and how do you record that once you've done it?
Brilliant, thank you.
And please, I am checking online on the screen as well. So if anyone does have any questions, please just raise your hand and come in. Okay. So you've looked at what you'd like to achieve. Now, when should I involve people? When is appropriate to do this? And the answer is it's never too early. I think your point there just made that point. It's never too early to involve people. In fact, the earlier the better. So even before you've had your idea, your research idea, your concept, it's a continuous cycle. So it's absolutely never too early to do involvement. Also, in every area where it is possible, relevant and meaningful. So what we want to avoid is tokenism. So what we don't want to do is involve people for the sake of being able to write in a report or say, I had someone sat in a meeting with me, I attended a engagement event and I spoke to people, but I've noted that as involvement. What you really need to think about is where it will meaningfully make an impact to your project. Here is the research life cycle, and these are the key points identified within a research life cycle. So the key areas of where we can involve patients and the public. We spoke a lot about identifying a research question. Key, writing and submitting a funding application, so further development of identifying a research question, how that would look in practice. Mandatory at this point. Hopefully, once you receive a funding application, submitting for ethics approval. So looking at design and approvals process, again, mandatory here. But there's many things that people can help, and that can be very pragmatic as well. Just simply, do I think it's acceptable for you to invite me into City Hospital for 3 visits a week? That's on a very high level clinical trial. But in this respect, could be, is it acceptable for you to access my data for that purpose? Is it acceptable for you to analyse my samples retrospectively for this purpose? So it's all ethical and moral questions that we need to ask ourselves. Carrying out the research. This is about research that is delivered by patients and the public and users, and not just to. At NUH, we do have our research volunteers now that act as a vehicle to allow them to be in the hospital co-delivering research. And I think that's a whole other session, so I can chat more to you about that another time. But then it is about co-delivering the research, so having patients and the public analysing research review, helping people complete questionnaires, helping them conduct peer interviews or focus groups. So there's many, many benefits to having patients who live with that condition or at risk of developing that condition, or the public at large offering that peer-to-peer support in regards to your project as well. Just mentioned analysing research outcomes, so we do have a lot of our patients who support in analysis, and there's many ways we can do that as well. Requires some training to that user, but we do support people to do that. And publicising research outcomes that then influence clinical practice. So this is a bit that we find, from survey results, it seems to be less prominent. People can get to the end, write the publication, and then forget to actually disseminate the findings and results. And if they do, it might not be getting, as I said, in front of the right people. So that is an example of the life cycle. Not saying for every project this is going to be different. Not saying you'd have to do involvement at every juncture, but it offers almost a programme of availabilities and options for people to think about. Just to repeat again, it is what is going to be most meaningful to your project. So avoiding involving people for the sake of involving people. Any questions on this slide? No? Any online? Okay. Right, who should I involve? That's a great question that I get asked probably every other day. Again, this is not a one size fits all. It is absolutely essential to focus on involving the right people rather than the most available or easy to reach people. And that is my key takeaway in regards to this. The greatest impact will be from involving those people who have had the most relevant lived experience. And I think for people online and in the room, that might be the public. It might be someone who has not developed a condition yet, but might be at higher risk of developing a certain condition. Or it might be someone who is living with the condition, or a carer, parent, relative of someone living with that condition. It's fundamental to make sure we're involving the right people who have also been through a patient pathway most recently. Pathways change, so what we want to make sure is we're getting that fresh, rich, lived experience as well. Yes, I think I've just mentioned my whole slide deck. So it's also important to use those who are undiagnosed. I think a lot of people think for involvement it has to do with people living with the condition, but actually it's those people who are at risk. And I think for a lot of research and projects that is definitely something to highlight. And I have mentioned this before, I'm going to mention it again after this slide, but it's imperative to ensure we're involving people who may experience poorer health outcomes, called them, or health inequalities currently, The reason people would be experiencing health inequalities now is because we've conducted research in the past that maybe hasn't included them and hasn't involved a representative sample of the patient population. So it's fundamental we need to tackle that health inequality gap now, involving the right people in the right project. And also at higher risk as well. And that's imperative. And we have tools to help people identify who that population is as well, that I think is your research that we can help you with. Yes, and just to reiterate, because there's some guidance out there about this, patients, carers, the public, they do not need to have a science background. They don't have to know anything about involvement. What is important is that they're experts in their lived experience. And that's what's most important. We support them to be involved. And I think another thing I'd like to highlight is that in research and in general, navigating the NHS as well, can be quite rigid in our structures. And I think we can make it quite hard for people to get involved, but people want to be involved. So we need to go and, be accessible. We need to go to them and fit how their lives are. People have complicated and busy lives. I mean, we all do in the room. So we need to make sure that we're amending our methodology to fit the people to whom we need to involve. Okay. Any questions about this slide? No. Okay. How do I find people to involve? I've said my strap line for today. Involve the right people rather than the most available or easy to reach. There are many, many ways, and again, this is going to depend on your population you're targeting. We're a huge secondary care hospital, so if you're looking for someone with a condition, it's very likely they'll be coming through the doors of the hospital. If not, primary care, where there are many, many networks, condition, disease support groups, self-help groups, charities that we work very closely with. If you're looking at the public at large, again, think about the demographics of who may be at more risk of developing that condition, or the demographics of Nottinghamshire, and think, right, we know Nottinghamshire has a high ethnic diversity, and we also know we have a high level of social economic deprivation. So we know if we want to get a representative sample of the Nottinghamshire community, we need to take that into consideration if we're doing public health, for example. So there are many, many ways we can reach out. There is no ethics that's required to involve people. If we're just doing involvement at its purest form, so speaking to people like we are now, you do not need ethics to do that. So if you want to advertise through, approach Maggie's support centre, you can do that and sit in Maggie's and speak to people. You do not require ethics at all. That's absolutely fine. So I think that's a big barrier for some people in thinking, because in research we have very rigid processes about advertising for recruitment. This is not recruitment, this is involvement. So we do not need any form of ethics. It's about, speaking to people. There's good practice, but there's no ethics or permissions that are required to do this. The thing to remember is that GDPR still applies. So in regards to legislation, we need to absolutely ensure we are still applying the principles of GDPR. So if you are speaking to people, and you're corresponding with them via email, just remember that is the case. If you're retaining any details, remember to be telling people why you're retaining them, where you'll be retaining them, that it's safe and secure, how long for, and that you'll continually offer them the option for you to get rid of their details from your database. As a means around that, I'm going off on a tangent, sorry, we do have a registry at NUH that I will share after this. It's got 400 plus members signed up to it at the moment, and these are people from a range of different lived conditions or just public members who are interested in getting involved. We manage that registry centrally and send out opportunities to everyone. So that is an option if you're looking for people to involve. We can put that advert out via our registry, or if you are looking to involve people, you can advise them to sign up to our registry rather than managing those details yourself. It's a bit of a plug for the registry. Okay, so that is how to find people. And again, we won't leave you on your own with this. You can come to us for advice, and we are always more than happy to signpost as to where you may be able to find the relevant population from. Any questions about any of that? None on mine. Okay. What kind of activity should I plan? So, like, what is involvement in action? What does this look like? Unfortunately, I don't, again, have a one-size-fits-all answer for you. It depends on whom you're involving and what works for the population, the people you are involving. Many sessions, so if you're looking for, so if we take an example of, I want to meet with a patient population to understand what's important to them, that could take the shape of an involvement focus group. This could be online or face-to-face, and that's about getting together a representative sample of your population, having time together, whether that be online or face-to-face, and having discussions around theme topics. So having kind of organic conversations that based around a certain theme. It's always good to plan questions in advance so you know that you're going to get out of the session exactly what you would like to get, so what you'd like to ask the people in the room. But it's also good not to be too rigid with it, because organically things can come out of these conversations that you never anticipated would come out of them. Again, we say involvement focus group, but that might not work for some populations. So having one-to-one conversations with people, that's absolutely fine. We have a lot of mostly around, well, recently on oncology, where people who we were speaking to said, we prefer just to have one-to-one conversations at this point. I'm not ready to sit down with others who have been in a similar situation. But then we get the complete opposite of that, who actually would really enjoy having the peer-to-peer conversations and see it as a bit of a peer support network as well. So when designing it, it is really about asking those questions to the people who you want to speak to. You also could disseminate, so for a larger, broader perspective, is disseminate a survey or questionnaire to people. We disseminated digitally or in person. And this allows you to get a broader perspective of opinions as well. So that's still in involvement. And there's also the much larger, more, methodological, the theories of deliberative democracy and citizen science approaches. And they are kind of the big, large-scale deliberative engagement models where you're continuously asking for people's perspective, for public perspective on a large scale, taking that back, it's like a feedback loop. So implementing it and then asking again, impacting it, asking again. So again, I can talk more about that. There's a whole methodology around that as well. So I think as I've already mentioned, it is important to remember to record the feedback and perceptions. So it's very important to, we do have I've referenced it here, a PPIE activity monitoring log. So that's recording what you've done, why you've done it, how you did it, what came out of that, and then what's going to change. So how has it impacted? And you know what, sometimes it's managing expectations, sometimes it may not impact, and that's okay. You've still done the involvement, and that is the, ethically, morally right thing to do. But recording that, especially if you're ahead of doing a grant application or an ethics submission, is definitely best practice. And importantly, if you're involving people, keep them up to date. Even if there's nothing to update them on. We find this a lot in a lot of projects. There'll be a lot of involvement, a flurry of involvement, and then people will go away and be delivering it or doing it, analysing it, and then they're not updating them, letting them know, like, right, I haven't got an outcome yet, but we're doing it. So it's just nice to keep people updated on that as we go along. Any questions? Yes, Carolyn.
If there was already a big conversation like that, something like that, inquiry and steps, can you kind of take that and say, well, the clearly done this properly with the population, so I know this is priority for us to do their but although this PPI is this way.
Yeah, well, yeah, so I don't really want to cut corners, but yeah, so it's always good to look at existing data and insights and what work's already been done. I will say, so exactly, for things like James Lind Alliances, which are priority setting partnerships for research, they will do all of the concept work. So the bit I spoke about at the very beginning, where you're talking to your patient population, they will do that work for you and come up with the research questions that have been deemed most important. It's like a top 10 list of research questions that have been deemed most important by that patient population. What I will say is, although that provides a really good evidence and foundation, and we know that that's patient priority, that might be based on a patient population that is not like local to us. So if you're doing your research specifically in Nottingham, or you may want to repeat that to understand how it would work locally for our population. And if it's specifically, if you're picking one of those questions, then still to understand how the greater detail of that would work, it would still be important. So yes and no. But a concept, yeah. Any other questions online? Okay. So what kind of activity should I plan continued? I've covered kind of the key concepts around an involvement focus group and session and getting people together and having a discussion. But there are many other ways in which you can involve people in your projects. So you can include them in your governance and oversight infrastructure, ensuring that they're involved in the decision-making processes throughout your project. One example of this in research is the public co-applicancy role, which makes the public contributor a formal co-applicant on a research grant application, so it's quite a responsibility. And then they are part of the decision-making process. Oversight committees, they hold that research to account. So that is another method of involving people that is more involved, higher level of responsibility. I think I've mentioned supporting delivery, analysis, and dissemination, so they can support involvement in all those areas. Co-author publications and co-design dissemination plan. These are just examples. We continuously, when we speak with researchers about their projects and develop their patient involvement plans, we'll come up with new ways that people can be involved continuously. So again, it's really thinking about what you want to achieve and trying to continuously broaden our horizons on how we can involve people, moving away from just the traditional methodology of involvement, which might be establishing a patient advisory group. Let's move beyond that. How can we involve people? Can we involve a network of charities, local support groups, and how can they be meaningfully involved and have impact? And ask them, sorry, I forgot about that, ask them how they'd like to be involved as well. Finally, on these processor slides is, and one of the questions we get asked a lot, is how do I budget for involvement? So these are the practicalities. There can be costs associated with involvement. Mostly, and what's fundamental is to try and ensure that no one is out of pocket for their involvement. So you're looking at travel expenses, refreshments, if you're planning a face-to-face meeting. It is important to think about, when planning this, make, again, access provision. So if you're looking to speak to a certain patient population, is inviting them to Queen's Medical Centre that good of an idea, to sit in a boardroom there when we could go to where they are? We go to a local cafe, public community events, or go where they're already meeting. So it's really kind of simple things like that actually will just make everything much more accessible for that patient population. Also costing, so this is relating to kind of like larger scale clinical trials, so but it doesn't mean that this doesn't apply to every single research or project that's being conducted. One of the key areas around payment is recognition for people's time contributing to research or a project involvement generally. I think I mentioned at the beginning, we follow two main standards for this. One is the National Institute of Health and Social Care Research, and they have a payments policy for involvement, but it is guidance, it is not mandatory. So they do offer and they advocate for offering people individual payment for their involvement, and there is a tariff based on if you attended a meeting that's 1 hour or 2 hours, you'll get a certain amount of payment. NHS England are the second policy providers and guidance providers for this, and they have a different payment policy. So they will offer recognition for a higher level of responsibility, but not for other levels of activity for involvement. So we are a compromise between both of those. That's what we try and achieve in research as NHS, but also research and innovation. So what we really try and advocate for is asking people how we can thank them for their involvement, rather than just offering them a monetary-based form of recognition. We find a lot of people do decline the offer of payment because they're doing it for, holistic reasons, but also that being offered money can incur some issues for people if they're in receipt of pension or benefits, for example. So actually people would prefer to be thanked in alternative methods, and that's what we truly advocate for. Examples of that is offering them educational programs, well-being. We had one where wanted to be taken on a walk around the university park and showing how to take good quality photos on their on their phones. Yoga, that was another one. Or a certificate, helping them write a CV. It's asking them how we can thank them. We do tend to have thank you and celebration events as well. So thanking people publicly and offering to get together a food and a public thank you. So again, it's just trying to think a little bit more creatively about that methods, but it is so important to thank people for contributing their time and sharing their lived experience with us. Another method as well is just by them being co-authors on publications, and actually that sense of achievement and accomplishment as being part of a team, because that's what they should be, as being formally part of a team. What time is it? Any questions around payment? I can speak separately about this as well. Yes, Caroline. Ah, yeah. Importantly, so there are funds available for people. If you're not applying for a research grant application, there are funds separately to applying for this, and I can circulate some other links after this. In research innovation, we have a business case form that can be used to submit your ideas and request for funding for patient involvement activities. And there are also other external to NUH providers of funding specifically for this that I will circulate. If you're concerned about this in regards to, I don't have any funding, but I know I should be doing PPI, I want to do involvement, please come and speak to us, because it should never be a barrier to involvement. The most important thing is to do the involvement, involve people. Any other questions before? Equality, diversity and inclusion. So I wanted to end on, I think, what I've kind of tried to weave throughout the session today. And this is such an important element now of any project. Again, like patient involvement, EDI, what it's referred to, or I like to say equity, because that's what it's really about, is now a mandatory requirement for any kind of research application, ethics application. When we receive outcome letters or feedback from funding panels or ethics, 9 times out of 10, they will mention you need to evidence how you're going to make this study equitable, how you're going to be inclusive, accessible, and ensure you're involving the representative patient population, how you're removing any barriers that we may be faced with in regards to getting a representative sample. So not only is it the right thing to do, it's mandatory now as well. So it is really about involving people who will experience those poorer health outcomes, really focusing in on who your patient population is, who really are they, what are their demographics, is there any protected characteristics there? And it's really narrowing in on that. And right, we know that people who live in the most socially economically deprived areas in Nottinghamshire may have a poorer diet, therefore they'll have potentially higher GI issues. How can I ensure that we're proactively involving them in this study, and how is that going to translate into how am I proactively ensuring they can be recruited into this study, as an example. Hopefully that makes sense. There is a lot of guidance on this online as well. I think a really good one, the 3 best ones I've listed here. The one at the bottom, the Equality Impact Assessment Guidelines, that's a really good toolkit, and will guide you through exactly what to look for and where to get examples of where to get that data from, that insight data from, and they will guide you through the process of identifying your population, the barriers faced, and how to overcome them and plan that into your project. But again, please come and talk to us if you have any questions. This is an example I've put in just in case anyone wanted to, after this, follow up and have a look at kind of an example of an involvement structure, and this is for the bioresource. They have involved people in a variety of ways, both at a governance level, at a community outreach level, decision making, and they're also focusing on continuously diversifying the samples that the bioresource collects as well, with their patient advisory group. So if you're looking for, again, just a tangible example of this in action, then it's a really good one to focus on and look at. And that's kind of it, really. We have a number of SOPs, the delights of reading our standard operating procedures. So they're all available on the NUH website. And we also do have we have templates, so we have a patient public involvement plan and guidance template along with activity log, and we are always welcome any feedback or recommendations on what else we can develop to be of use to people as you're navigating involvement for your projects. So yes, thank you very much for attending. I really appreciate your time. And any questions, please let me know. And as I mentioned, I'm happy to meet with people one-to-one after this if you prefer to have a chat separately. So thank you. I'm just going to stop sharing my screen. There we are. Yeah, thank you. Hello. Lovely. Thank you, Amanda. And thank you, everyone online. Has anyone got any questions? And I will remember to repeat any that are in the room as well. Any questions? Have I bamboozled?
I have lots.
Yes.
Because I think it's important to we put this session on Richard and asked Kate to come along to this session, put this session on, because we've had lots of requests for our PPIE help and ECS, but obviously. But we wanted to make sure it was relevant for people who are non-patient facing. So I've got a couple of questions that hopefully you'll be able to help. So what if the research we want to do is very technical?
Yep, so
8% of all diagnoses in the NHS are done by healthcare scientists. And the question is, would you like your diagnosis to be improved? they're going to say yes, aren't they? So how do you get round the technical nature of our work to get the public to be meaningful?
I'm just going to repeat it. It's a very good question. So everyone online, Richard has asked, how do we do meaningful patient-public involvement for work that is very technical? So, for example, if we were to ask the public, do you want a diagnosis to be improved, time quality to be improved, they'll probably say yes. But how do we get around that nature and how to meaningfully involve people in involvement work when it's technical in nature? So, yeah, good question. I'll say, if it's very technical in nature, it'll take a longer kind of relationship building process, and for them to have true meaningful involvement, it's best for them to be as informed as possible about the area that you're asking them about. So we always try and encourage educational sessions or explanatory sessions so they understand the process. So for healthcare scientists, I actually think it would be really great to do some more engagement work with the public about what, everyone does, how important it is. You've just mentioned, what is it, 80% of all diagnoses are done by healthcare scientists. I didn't know that. So actually having people who are more informed about it, then better able to have that meaningful input. We find this, and we have done a lot of involvement with very, very for me as well, very complex areas of research. But we find that the more we are telling them about that process where it fits in, the overall structures, it equips them better able to give meaningful feedback. It's daunting, to think about trying to explain something that's everyone's bread and butter and you do day in and out, and how to communicate that in a way that people, would be able to understand. But we're here to help with that as well. So yeah, I think training, education, relationship building, and yeah, I think without a real example of it, it's hard to answer any further than that. But hopefully that does help answer the question.
Well, it's very related to Richard's point. So with the technology is improving all the time, and we can do that. But when they give their sample, unless they specify otherwise that they don't want to involve in any sort of research or anything at all, we take it to mean that they've already given their consent. Anything we want to further do the risk estimate. So how does PPIE, how does patient
Right. Yeah. So everyone online knows an example for genomics. That consent is given at the time the sample is taken, and that consent includes use for research, genomics. So how can we do involvement for that? So there should be involvement in how that's done, how that whole process was done. There should have been involvement included in.
Yes, so they have a consent form or a record of discussion.
Exactly. And is that consent, informed consent around how they know that sample is being used? And it will be, but are they actually informed? Are they going away with further information about? I mean, there's ways to improve it. I'm not saying that will have gone through ethics, that will have been approved. That's fine, but there may be ways that now we can make improvements to that by speaking with. I mean, I assume you're not focusing on a specific. So you're not focusing on cancers, or is it just across? Is it
across those patients that we want to be able to explore further one day they have time? But nevertheless, it's a good resource sample for us.
Yes, it's a good resource sample. Yeah, and there'll be people with that live condition.
Who could benefit because.
Exactly, and so a key one there is actually asking them how should we be analysing those samples? Because I guess that's it's a bit like bioresource, I guess, isn't it? You have a repository of this information, and we should be asking patients what's important to them, how should we be using these samples, what research should we be doing. It's kind of a prioritisation question again, and I think, you know, there are limitations to that because we are a bit limited by the funding available, because funders do dictate a lot of the time what areas they want research to go into, and they should have done involvement before they depict those. But I think as much as we can for the genomic stuff, or anything that's involving a repository of samples or data, not only is it good practice to be asking them what it should be used for, but again, it's the ethical and moral stance as well around it, and engagement-wise as well, just transparency and visibility. We get a lot around the bioresource, the Nottingham bioresource. People give their blood and then they never, you know, they never hear from it, and they never, that's it. And even not knowing exactly what their sample has been used for, they would at least like to know what it's contributed to overall. And I think that is part of involvement. How can we make that practical? How can we feasibly do that? I think that's...
Make it a little bit strange because all this PPI found is coming from generic England as well.
Yeah.
I don't see anything there in the consent form that really specifies the need to do any research. We'll get that to you.
Okay, yeah. Which is, it's yeah, I mean, that's one to explore, so yeah. I'd be happy to pick it up outside of, I actually work with a PPI in Comsley from East Genomics,
Right, okay.
England. We're doing some outreach with Roma Gypsy Traveller and South Asian community next few months, so I'll pick it up outside. Sorry.
Okay.
Caroline.
I'm actually a really good example of this when people are just saying, use my samples. And there's a web page and they give examples saying, these are the kind of things research we have done on samples, so people can see what's happening. Maybe not there, but that this is the type of research we're doing. And I think that's really good, like any sort of general thing like that, to have feedback so people can say, if you scan QR code, you can see the leukemia with MS and with doing how we analyze samples. And it just looks, in very simple language, it's just like basically how to help them.
Yeah, exactly. So to everyone online, Caroline was just saying that one tangible example of how you can, well, I guess it's a impact of people's feedback. So this is involvement in action, is that when they've donated a sample, never heard anything about how that's been used. But one example Caroline's seen is having a website where people are stating what trials have been used, what the outcomes for their trials are for that biobank or registry as a whole. So they may not know it was their sample used for that particular study, but they know they've contributed to that because, I mean, practically there's going to be a lot of like logistical and governance issues in collecting every single person's contact details, keeping that up to date. I'm not saying that this is impossible. It should be like an aim for everything. But if you're looking at it from that perspective, it's a good way to let people know and thank them again, like continuously, for what they've donated to. So there's things to explore. There's already feedback that's been implemented for involvement, but I do think it's, if you look at big data as well, it's the same concept. People who have been using open completed a questionnaire, and you know they're not receiving any feedback about how that's been used. It should be a continuous feedback loop. And so I've just got someone online when you've mentioned how do you involve people in genomics projects. Stevie has said you ask them how they want to be involved again. Go back to that. So Stevie is one of our patient contributors. Thanks for joining us, Stevie. Okay, I'm 1 minute past, so I do apologise. If anyone has to go, please do. You don't have to stick around. I am available for another half an hour. So if anyone wants to stay and have a chat with me, feel free. I will pop our inbox, our team inbox is get involved, which was on the last slide. So if you have any questions after this, then please just let me know. Don't hesitate to contact us. Thank you very much. I think I'm still. I'll stop recording. That's okay. Oh no, I haven't. There we go.